All right. So as people are getting transferred in here, I just want to welcome everybody to the October, October installment of Vibrant's educational webinar series. The much awaited and anticipated Lyme and Tick-borne diseases panel just launched a few weeks ago, and we are super lucky to have had Dr. Gordon Crozier, who, if you guys attended our, I think it was February webinar, he talked about micronutrients, did a fantastic job, covered some really intense information. So he's back again. He piloted this test for us. He ran some samples before we opened it up to anybody else. And we got to chat with him about his thoughts and hear his excitement. I think Dr. Crozier is probably one of the most excited providers that I've ever talked to, especially when it comes to this Lyme test. So Dr. Crozier, just a little bit about you, for those who are hearing you for the first time, or for those who remember micronutrients but not familiar with your work with Lyme, what's your background or your experience? What kind of got you into Lyme, and how long have you been doing this?
So I became very interested in Lyme. I was working for the university. I was clinical faculty at the University of Kentucky. I became extremely ill, but I had really been ill most of my life, on and off, not really realizing what it was. And this is over 10 years ago now. And when I became very ill, I began passing out in surgery. You can't really do that when you're a surgeon, pass out during your surgery. So I had to go on clinical disability. So I was on disability for a little while. During that time, nobody could really figure out what was going on or why it was going on. Nothing could happen. And so I started doing my own research and started digging. And it's what it really catapulted me into doing integrative medicine, but it also catapulted me into understanding my own disease process, and that I really had Lyme. I was positive on a traditional Western blot, which most people are not.
Wow.
I was positive on a traditional Western blot. Nobody ever even bothered to do the test on me. So not even thinking that that was a possibility. So, it was kind of eye-opening for me and for me to realize. And so as I struggled to get my health back and my life back, I realized people need help with this. And it's just a disease that people still don't look at a lot or highly. So right now I get some infectious disease people in the Orlando area that don't want to do anything with Lyme. If they have anybody that's positive for Lyme, they just like to send them my way. So I really became very interested in Lyme at that point, and really began to understand a little bit more and just delve really deep into it, and understanding really a lot of the European studies in Lyme as well. And because they've really kind of forged the way in some aspects in prevention and some of the other things for Lyme, because it's a worldwide epidemic. It's not just the Northeast. So,
Well, and I'll say this too. I mean, the more we learn about it, the more we realize we don't know about it, and it's just a very complex set of symptoms and conditions and disorders. I mean, I just know, from what I know of those that treat Lyme or that deal with it, no two people are exactly the same as far as how they present, and that's what can often make it so difficult to diagnose in traditional practices. But even in, the more integrative field, we're not always looking for it because it doesn't always present with those like textbook symptoms. So we are absolutely, indebted to you for taking your time tonight to talk about the test, your experience with Lyme. And I got a sneak peek at your slides. I'm pretty excited to see all this. I think you have some case studies too. So I won't waste any more time. I'll turn this over to you and let you jump right in.
Okay.
Thanks a lot.
So the history of Lyme, Lyme or Borrelia burgdorferi, was first diagnosed in the 1970s. But we have to understand that Lyme has been around for a lot longer than that. For those of us, when I went back through my history, it was actually I was bit in the 1960s because I'm a little bit older now, and suddenly could no longer read. It took me 4 years to be able to gain that process back for me. So it was much before the 1970s that a lot of children were actually being bitten and not realizing what was going on. But Lyme actually came about, and it was first diagnosed because of a symptom of fever and arthralgia. Some of the children had joints, painful, but the children, they were living along wooded areas near Lyme, Connecticut. And that's how it came about that it was called Lyme disease. But it's really Borrelia burgdorferi. The other interesting thing about that is that there are approximately 30 species of Borrelia at this point, and we call them all Lyme disease. It doesn't matter what form of Borrelia that you have, they're all called Lyme disease. So the CDC has a wide range. It's a very wide range, and that should be 296,000. So a range of 296,000 to 444,000 annual cases per year. The problem is that even the CDC admits that this is an underestimation. So there are a lot more cases than what we really know, and I believe that Vibrant's going to help us solve a lot of that. So some of the common signs and symptoms, bullseye rash. Well, if you're in my practice, it's only about 10% of cases. And if you talk to most Lyme doctors, it's only about 10% of cases. However, the CDC reports that the bullseye rash is in 70% of Lyme cases. So that's kind of an interesting, and there's a disparity there. And I don't exactly know why, but there's a difference. So headache and stiff neck, that can be a very common symptom. Arthritis, facial Bell's palsy. Being a person who had Bell's palsy twice as a young boy, it's one thing that I really think that people ought to take more look at and make sure that they don't have Lyme disease. So nerve pain, heart palpitations, and that's why, we talked a little bit earlier about it being a multi-system disease process, and that's part of the issue here is that it affects so many different organ systems. Shooting pain, numbness, cognitive problems, and I'm going to talk a little bit more about cognitive problems in a little bit, but that's why they call this the great imitator. So because it imitates so many diseases and so many disease systems, and I'll go through some things that I've had and seen in a little bit. So often it can be misdiagnosed as something else. A lot of people say it's because the people are uneducated, but I don't think that they're uneducated. They just do not understand Lyme, and none of us do, because it is a disease and a process that's continuing to morph and really mimic other things. And a lot of people will say that I went to my doctor and they said, well, it wasn't found. There is no Lyme in my state. So then they end up coming to me, and I said, well, Lyme has actually been found in every single state, and we know that, and you can look at the CDC. The CDC states the same thing. So the World Health Organization, which is the World Health, is a little bit different than our CDC. So our CDC and the American modalities state that this is only one type of tick that can carry Lyme disease. But the World Health Organization admits that ticks are the main vector, but they admit that all blood-sucking insects are possible vectors for Borrelia burgdorferi. There's actually studies in France, studies in Germany, and several other countries that have proven that there are other vectors for Lyme disease. Right here in my own backyard, the University of Central Florida recently did a test, and this test was with mosquitoes and chickens. And they found out that, in fact, mosquitoes can carry Borrelia. So it's kind of amazing that, we know that. So, so here's some of our blood-sucking insects that possibly might be carrying things. The bed bugs, fleas we know actually are very common in carrying Bartonella. And Bartonella is one of the co-infections for Lyme. But, if you have Bartonella and Bartonella alone, maybe it's fleas only that you had. So we have all these different things. Neuroborreliosis, before we were talking about cognitive problems. So neuroborreliosis happens to be probably about 80% of my Lyme cases that I see. So why? Because nobody else wants to do with them or deal with them, because it's a very complex disorder. And a lot of people are diagnosed with psychiatric disorders that really truly have neuroborreliosis. So it's a disorder of the central nervous system due to the spirochetes. In the United States and in Europe, both, between 14 and 34%, kind of a vast, wide array again, that have Lyme will actually develop neuroborreliosis. And I thought it was kind of interesting because Europe has different genotypes than we have, but it's interesting because they both are about the same amount, from 14 to 34%. So neuroborreliosis is a very difficult diagnosis. And it used to be that we needed spinal fluid to really get that and try to get positive results. But even then, we were not getting positive results. So a lot of the people that treat neuroborreliosis stopped getting the spinal fluid and really started treating more on the symptoms. But now with the new Vibrant test, we know that it is so sensitive that perhaps just getting that blood test will actually, and then them having the neurological symptoms, might really help us a lot in the diagnosis for neuroborreliosis. And I have to also say that there's another test that Vibrant offers called the NeuroZoomer that I use in all of my neuroborreliosis patients because of the autoimmunity that Lyme patients can have. So autoimmune diseases, it's estimated that 1 in 5 Lyme patients will develop an autoimmune disease. Some of them even like MS. So I've had several MS patients myself that actually did not really truly have MS. They really had Lyme. When the Lyme was treated, they really reverted back. I even had a couple ALS patients that really were truly not ALS. They were more Lyme. And I had one that went back to a very prestigious center, and she went back walking and talking where she wasn't able to talk well, and she was in a wheelchair, and she went back walking and talking, and she thought that her doctor would be ecstatic that she was better, and all he did was tell her, "Oh, I must have misdiagnosed you," and walked out of the room. Well, that was kind of devastating for her, and it was kind of heartless. But I know we don't like to miss a diagnosis, or that we don't want to be wrong. But we need to be open and happy for our patients when they find healing, even if it's not in our house. So if something's beyond me, I try to get them to the right help that they can get to for help. So, and the other thing is, treated or untreated, the combination of antibiotics and toxins or biotoxins from Lyme can affect the mitochondria, resulting in devastating effects. So mitochondrial disease is escalating every year in America. And when you look back, the numbers are at a steady incline. It's ridiculous. And I think a lot of this is because of the biotoxins affecting the mitochondria. And we don't understand, but antibiotics are also affecting that. So I would like a test to be able to be done so we can look at the mitochondria and we can see, actually, is it antibiotics? Is it Lyme toxins? Is it mold toxins? Or what is it that's affecting the mitochondria? And I think that's going to be right around the corner, hopefully. So in testing Lyme, traditionally, as I said earlier, I was positive on the traditional Western blot, but not everybody is. In fact, most people are not. So that's using proteins to confirm the presence of antibodies, which really are rarely reproducible. And we've found that over and over and over again. So there's been other Lyme tests on the market for around 25 years, but they still are using a lot of the same principles as the Western blot. They just are testing more bands. And when I'm talking about bands, I'll explain that when we kind of go through a couple of these case studies that are coming up here in a little bit, because bands, the more bands you have, the more possibilities you have of having a positive test, not according to the CDC standards, but according to the other standards or people, the Lyme literate doctors. So that's important, but it's not all inclusive. More recently, a lot of studies started doing PCR testing. So, and PCR testing is testing with isothermal DNA amplification. So these strands of polymerase chain reaction, and so they're testing actually the DNA of each individual organism, which is really great, and it's awesome. However, we have to understand that Lyme hides itself both from our immune system and our circulatory system, and it burrows its way into muscles, into joints, into all kinds of different tissue, fat tissue. It's going to hide out everywhere, and it's very difficult to get that positive PCR testing. But I think that we have some, and we can see it, and I think it's a very useful test. But when you were doing this PCR testing, we would have to get a different test first, and then we'd have to go to some place that does PCR testing. And so you'd have to do 2 separate tests. Well, not anymore. Thank goodness. So not all tests were including all forms of Borrelia. Of course, we can't really test for all 30 forms of Borrelia burgdorferi, but let's test for the most common ones that we have in the United States. And that's exactly what Vibrant has done, is they've been inclusive of tick-borne relapsing fever forms of Borrelia. And so it's more inclusive, and it helps us see a bigger picture of what's actually going on with our patients. And then not all testing has before had all the common co-infections of Lyme. Now, there's some people that they'll go to co-infections and they'll get these really wild co-infection types, but really Vibrant has included the ones that are the most common, the ones that are recognized as being the common forms of co-infections, which is really great, and I think it's a benefit. So, and not all testing are in testing like Vibrant has been. So, Vibrant came out with chemiluminescence. I can't even say it correctly, but it's based on an enhanced testing. So it makes a high sensitivity for detecting infections from tick-borne illnesses, including Borrelia. And it has an enhanced IgM for earlier detection, which is really critical. The other critical thing is it's all-in-one blood draw, because if you've ever tried to draw blood on a Lyme patient, they're very difficult, and they've already had so much treatment that a lot of them don't have any veins left. So it's really nice because it's one blood draw. And it's going to test for the different forms of Borrelia, including the tick-borne relapsing fever and co-infections. It also includes the PCR testing. Now, you can just get part of it if you want, but I don't suggest that. I suggest getting the full panel. If all my patients going to get a full panel. So it's the science of light. And it's really, really kind of cool because it's cool light. It's not heated light, but it's without heat. So chemiluminescence has been around for a long time. So it was first discovered in 1669, believe it or not. But the science wasn't there to be able to use it. So it's the emission of light from the production of a chemical reaction. So this chemical reaction is going to create this production. So it's better than fluorescence, which a lot of people know about fluorescence for detecting things. It's more sensitive than the ELISA test as well. So I believe that this is going to help us with a lot of our false negatives. And it's going to, it also gives us a higher level of the IgG, which can be masked by the IgM, which can mask the IgM. So this new testing also provides better detection of the IgM antibodies for earlier detection, which is important. The earlier that we can detect this, the better outcomes we can have. So we used to have to wait for up to 6 weeks. Well, we might not have to wait that long now. We see that we can see it within 1 week. We can have the antibodies can be positive with this new type of testing. So the order of magnitude is 2 more than the fluorescence and 4 to 6 more than the chromogenic reactions. So what does that mean? It's the order of magnitude is an exponential change in the value of a quantity or unit. It is generally used in the power of 10. Therefore, 10 to the second for fluorescence and 10 to the sixth for the ELISA. So this is impressive and can radically change the need for intervention. So chemiluminescence can have detection much earlier. Instead of, like I was saying, waiting for the 6 weeks for a positive test, we now can have a test positive in a week. Of course, a lot of us go ahead and start testing somebody if we think they're going to have Lyme and it's a new onset. I don't wait. I start treating them right away. I still get the test and then I treat. But also what I think this test is going to be imperative for are people who have been partially treated for Lyme, who have been maybe on some antibiotics, but maybe not enough, or, people that might have a negative ELISA test, but, let's see what we really are. And I think that this is going to help us. So this may alter our treatment modalities. It may help see the need for antibiotics, and it may help with the need for other treatment options. So if you've been treated with antibiotics, you still have a positive Lyme test, well, why are you going to treat with more antibiotics? And I'm going to say that because Harvard actually did a study, and they were proving that Borrelia becomes resistant to antibiotics within 72 hours. So what are we going to do? Change antibiotics every 72 hours? Well, we might want to do something like that, but I think you can trick the organisms by using other modalities as well, including herbal things along with antibiotics and using other modalities. So we can kind of go back and forth to really trick it and be able to get to the root problem. So early detection is key, but prolonged antibiotics can be detrimental both to our gut and to our mitochondria. So if they've been on long-term antibiotics, there's other tests available by Vibrant that will really help you with that and looking at individuals' guts. The case 1 presentation, this is a young Benny, he's a 17-year-old. He had a 3-year history of Lyme, and he has been treated by several doctors, actually many doctors, many different forms of treatment, both naturopathic, holistic, antibiotics, you name it, had been through a lot. But this poor kid, I felt so sad for him. He was unable to attend school. He was now 2 years behind in school. He was unable to participate in sports, and he loved sports. And he was having pretty significant cognitive impairment, headaches, unable to concentrate, couldn't even remember what he had been reading. And so it was a real problem for him. So he came to me, and I had already started kind of treating a little bit, but this test became available, and I wanted to see where we're at with our treatment modalities because he had previous treatment. And of course, all of his other tests, and I won't say the other companies' names, but there were several of them. They were all negative. So, where was he? Well, I was able to get this test, and as you look at this, you can see his Lyme immune chip IgM, that he's negative the whole way down. It's in control. And you know what else I love about this test, and I'm just going to tell you right now, is because it's very easy to understand. Nobody needs anybody to hold their hand to understand this test. It's very easy to understand this test and the parameters. I have had so many doctors call me and say, I have this Lyme test. I don't know. Is it positive? Is it negative? I don't know what it is, because they don't understand the other testing. And they've made it very complicated to even begin to understand. But this has been very, very simplistic. And I love it because it breaks it down for everybody. And maybe I won't have as many phone calls. So, but you can see on the AIGM he's in control. But look at the IgG, he's not. So, he has had treatment, but you know what? The treatment wasn't good. He needs more treatment. And so I immediately went on a change in what I was going to do for him and how I was going to implement some other things like high dose IV vitamin C, maybe some peptides and other things, because antibiotics evidently weren't completely working. So let's change our thing. So you'll notice that he's high risk in the C peptide. And C-peptide is kind of interesting because it's one of the things that is an early detector, and I'll talk about that in a little bit. So then he has the band 18 band, the 23 to 25 bands are positive, the 28 band is positive, his 41 band is positive, and the 58 band is positive. So he's positive by CDC standards because those are recognized bands by CDC standards and by Vibrant standards. So those are the bands I was talking about, that some just expand the bands. His PCR testing, the Lyme PCR testing over here, you can see that it was not detected, which is good. I was glad, but it's not uncommon. But the antibodies are here. We know these antibodies are real. Those antibodies are true. So, the PCR, we couldn't get it, but, maybe we will. Maybe we'll break up some biofilm and we'll repeat it and we'll have it. So the tick-borne relapsing fever immune IgG chip, you'll notice is negative. Babesia is negative on the IgM and IgG. His Bartonella was negative as well. Very good. So I think that some of the treatment, probably because most people are positive on some of these things, his Ehrlichia and Anaplasma are negative. And everybody says that Ehrlichia is easy to treat. And let me tell you, it's not as easy as what people are saying. His Mycoplasma is negative, Rocky Mountain Spider Fever. I love that that's included because that is in more than just the Rocky Mountain states. It's in a lot of places. And tularemia is also negative, which I love that because I have people that come to me from Central America. They have a higher incidence of tularemia there. So the second case, she was a 32-year-old female who had presented to me with a positive Western blot, but she had had several Western blots before that were all positive as well. And she had already been treated by some other integrative doctors, even here in the Orlando area. So she's already been treated. She was treated for quite some time, for many years, but she was still positive when she came to me. So then I repeated it. Her second Western blot that I had done was negative. So then this test came available, and I said, I want to see if she's really negative. Is she really negative? I want to know. I want to know some more sensitivity with this. So after we had finished her treatment, and we did this test, and you will notice her Lyme immune chip IgM is completely negative. Her Lyme immune chip IgG is completely negative. PCR testing, negative. Tick-borne relapsing fever, negative. Babesia, negative. And the Babesia was really strong before, so that was one of the hardest things to get rid of for her. But it was now negative. Her Bartonella, now negative. So that was positive before as well. It's now negative. So she had her Mycoplasma negative. Everything was negative for her. So what's it tell me? She's feeling better. She's looking better. She's doing better. Now we're just in the process of rebuilding her. So even though I've finished treatment with these people, I continue on with rebuilding them. No, I'm not one of those people that once you have Lyme, you have to, even if you have negative test results, you have to stay on antibiotics forever. I don't believe that, because I believe that only destroys your gut, destroys other things. No, after you've gone through this, let's rebuild your gut. Let's rebuild those things. Let's rebuild your cells, because your cells are imperative for your overall health, to rebuild and repair. And that's what I try to do. Here's case number 3. She's a 44-year-old female, and she presented with a past history of Lyme. She'd been fighting Lyme for over 15 years, and she's seen, I said 15 doctors here, but I looked back today, and actually it was 20-something doctors that she saw in the past, in and out of the country. My initial thought was that she really didn't have Lyme. I think she really had Lyme. And so I want to know, is it really Lyme at this point? Because it didn't seem like it to me. So her Lyme immune chip IgM, negative. IgGs, negative. PCR testing was negative. Tick-borne relapsing fever, negative. Babesia is negative on the IgM and IgG. But look at her Bartonella. Her Bartonella is still positive. She's high risk. And you know what, this woman, she was having a lot of headaches. She was having a lot of difficulty neurologically. She was having swings emotionally. And if you look up Bartonella and you look up what it really does and how it can affect us neurologically, you can really begin to understand that, yes, this is an actual true, it's just exactly what I thought. It's exactly what I kind of was believing at the point when I initially saw her. But thank goodness we had this test now available, and we had a positive result. So now she's in treatment, and she's already clearing up. Her mind is already clearing up. It's pretty phenomenal how fast she's turning around once we were able to get to the root of her problem. So I'm anxious because I want to repeat this now in a little bit. So her mycoplasma was negative, tularemia is negative, Rocky Mountain spotted fever negative. So I wanted to talk a little bit about that C peptide. C6 peptide in 2014 in clinical microbiology was discovered that the C6 peptide was important for early detection of multi-system Lyme. This was found in Borrelia burgdorferi as well as the European genotypes. So it crossed over into other genotypes, which was really important. But this is incredible because we have this. Not all Lyme tests include the C6 peptide. So not all Lyme tests can have that, but we have it here. It is very imperative because this was always largely inaccessible to antibodies, but this kind of gives you a hint as to an earlier detection as well. And we knew that if this was positive since 2014, so and a little bit before that. So there was some studies before that, but it wasn't really available for physicians to do the C6 peptide until around 2014. The VISE1, this was a variable major protein-like sequence. So that's what that stands for. It's a protein that's involved in the antigenic response, and it's on the surface. So these are surface proteins of the Borrelia that can react, that we can detect. And this is also available on this test. You'll notice that was one of the first ones on this test. Was number 1 on the IgG and IgM. And so it's very important because this is can be also a very early detecting in detecting Lyme early and detecting what kind of circumstances these people are going to be in. And so it's a very thorough testing. So I believe that we should do all of the tests. I believe that you shouldn't just do part of it. That's just my belief. If you believe something else, that's okay. But I just believe that we need to be thorough with these people. And I'll tell you why, because you can get all of these tests for a lot less from Vibrant than from any other company. And these are going to be more accurate. That's my belief. And because of the science behind what they've done and what they've developed. So every test that they develop, it seems like they go above and beyond, and they make it more bioavailable for the patient and for the clinician, so that we can be more accurate in our testing and we can do much better. Now, I'm going to strongly encourage you that if you do have a Lyme patient and you do this test, please don't just do this test. Please do the Neurozoomer, because you'd be surprised. You can see some autoimmunity there. You might be surprised at what you see. There's also some other tests available that I do on most of my Lyme patients. So the tests are reasonable, they're available, and I love them. And so let's fight Lyme. Does anybody have any questions?
Hey, thanks so much, Dr. Crozier. Yeah, I think there is also one, there's already one question that's been typed in. I'm sure people will start flooding those in. While we're doing that, I do want to throw out, for those of you who haven't already heard from your territory sales managers or sales reps in your area, or if you don't have one assigned, if you're just kind of tuning in and you're new to Vibrant, through the end of November, so the Vibrant tick-borne diseases and co-infections panels, if you run them together, they're normally $500. They would be $300 separately. So if you run Lyme separate and then co-infection separate, they're $300 or $500 together. But through the end of November, it is only $400 to run the entire thing. So if you're listening in and you've already got some clients in mind that you think would really, really benefit, basically it makes it very affordable and easy to get these panels in. Plus, if you do, obviously Dr. Crozier recommends running the Neurozoomer for basically just about the same price as the normal panel for just Lyme and co-infections. You can throw a Neurozoomer on there. So I would totally recommend doing that. This test has just been really cool, and I'm glad that, Dr. Crozier, your experience with it, it looks like it basically showed what you were kind of thinking it would show, which is always kind of nice to see. But then sometimes, obviously, as providers, we think we're going to see something and we see something totally different.
Right.
So that's the whole test, don't guess. I can go ahead and read off the questions we have so far. Let's see. So the first one that came in, Sean asked, are you implying that presence of IgG indicates active infection?
Well, it certainly can. It doesn't necessarily have to. That can be an old infection. And of course, with some people getting the new vaccine available, that could skew things as well. But that's going to be more in the C-peptide range that would be there for the IgG. So it might not be an active infection, but this young man was not still not where he should be. So I knew it was more active for him.
Okay. So Cindy asked, what are the treatment options you offer while waiting for test results? So are you doing anything in the interim?
Sure. Well, I do a lot of things because I have people from all different realms and all different walks. Believe it or not, I have a lot of naturopaths come to me, and I have a lot of chiropractors come to me. So they don't necessarily want antibiotics. So I'm not going to necessarily do antibiotics, and I'll do different things for them. So there are certain herbal remedies that I'll use in combination with like garlic, oregano, olive leaf, colloidal silver. For those that don't like it, for those, and it's a real recent one, I still go with the standard, and that standard protocol is doxycycline right away. So if they're not allergic to it, I'll use that doxycycline if it's a right away and it's an immediate thing because I want to get at it right away, especially in these younger kids. So I will do that while I'm waiting for the test.
Great. The next, more of just a comment, but this is actually something that we've been asked a handful of times, and I'd be interested to hear your thoughts. And so it looks like Thomas Hobbs said a provocation test will increase the PCR. So what are your thoughts on provocation prior to testing for Lyme? Or
Yeah, I think that's good. And I think we should do that because I think you will probably have a better PCR testing. So, and you can do what you want to do for provoking it.
Great. Let's see. So Melissa asked, what is your initial treatment?
So if they've never been treated with antibiotics, I will still go with antibiotics. And if they've never had anything, then I still go with Doxy first. A lot of times Doxy is not going to be enough for a lot of them. Most of my people that I get have already been to 15, 20, 22, 40 doctors. So they've already been around the block. They've already had antibiotics. A lot of my people already have destroyed guts from so many antibiotics. So my initial treatment might not be like the average. But if they are a brand new patient, brand new tick bite, I will use Doxy. I will use antibiotics. And then the other ones, then I try to figure out what antibiotics they had and what ones they have not had. And then I will combine other treatment modalities like high dose IV vitamin C along with antibiotics. You can use ozone. You can use, there's multiple different modalities. And for me to get into that, that's like a 2-day lecture for me.
Right, right. And also I wanted to throw out that Dr. Crozier also is on the side, kind of does some mentoring as part of his business. So if you are a provider and you need some help with that, that is something that he offers as a service. I know he's very, very busy, so I don't know what his time availability is, but he is somebody that you can get in touch with as far as, questions in case we don't get to everything tonight. Let's see. So Sherry, if IgM is positive and IgG is negative, what does that mean? Is it positive regardless?
So so IgM is going to be more of a recent, and so it's usually untreated. So I would go ahead with the treatment modalities. I didn't have anybody that was positive on the IgM because most of my people have had some kind of treatment in the past. However, I think we're going to have one coming up this week, so it's not in time. That would be positive on IgM, but it wasn't in time for this one.
And I think that IgM, isn't the half-life relatively short? It's a few weeks. Yes. Is that correct?
Yeah, it's only a few weeks.
Yeah. So even if they're untreated, you would only see IgM elevated, in very early stage Lyme.
Right. That's an earlier.
Okay. Let's see. Oh, Dr. Hubkova. Hi, how are you? She asked, how do you treat chronic Lyme?
So chronic Lyme, boy, and it depends on a lot of things. So
that's probably complex.
Yeah, that's very complex, and it depends on what modalities are affected. So most of my chronic Lyme people are neuroborreliosis, so they're neurological. So I want to bring down any autoimmune possibilities for people because almost everybody with chronic Lyme are going to end up with some form of autoimmune disease. So even myself, I ended up with Hashimoto's thyroiditis. I had Crohn's disease. I had autoimmune diseases that were numerous. And so the problem is calming down the autoimmune state. And you can use many modalities, but you have to figure out what's going to be right for that patient. So sometimes you want to do some, maybe some genomic testing, see what their DNA is, to see which ones are going to help them the most. And I try to do that. So I'll look at the person, and I just have to tell you, it's highly individualized, and I can help you out with that. But that is like, I have to spend a week with you.
Yeah. Let's see. And so then I think you kind of already answered this one. Melissa asked, additionally, won't IgG always stay elevated if you've been exposed to Lyme? And I believe to a certain extent it does. Is that correct?
To a certain extent it does. So usually a lot of times you'll see, especially the 41 band, and most people will stay positive. There's a few people that were positive that now she is negative, and I showed you that example. So she really wiped it out. And her treatment modality, I used multiple things for her, but really for her to get back to where she's big in the business world, and an inventor. So she was pretty powerful woman, but really for her to come back the entire way, we really needed to do other cellular modalities as well.
All right. Let's see. Sean asked, is there a possibility of cross reaction with some of the bands as I have seen in Western blot on band 41?
So you know what? That I don't know yet. And I'll be interested to see. So band 41, yes, can have cross reactivity with quite a few things, including mycotoxins.
Mm-hmm.
So 41 band is kind of an interesting band, but it also is the one that seems to stay positive the most frequently. So I don't know about 41 band being positive on this specific test like it is on the Western blot or some of the other ones.
That's definitely something we could keep an eye on. I mean, we can pull stats from the lab periodically just to see if we're seeing certain trends. So I'll actually write that one down and ask maybe in a few months once we've had a good enough number of samples come in and just see if we happen to see that.
Right.
Let's see. Kelly asked, what are your thoughts about low-dose naltrexone for Lyme?
So in some of my patients, it works great, and other ones it does not. So I have seen great results with LDN, and some of them have been better than others. But I still will try it, especially when other things are not working so well, and they're really in need. They're desperately in need.
Great. Let's see. Let me scroll through and see what we've got here. Since the Borrelia, so Greg asked, since the Borrelia can change its surface proteins to hide from the immune system, is this test testing for a variety of known surface proteins?
Well, it tests for some of those surface proteins, but it doesn't test for all those surface proteins, but it's also testing deeper. So because of the way the light is testing, you can have a cool reaction. So because it uses a cool light treatment to actually see them, it's a different modality in seeing it. So it's going to be a lot more sensitive because that's part of what that pirate heat does. A lot of times sometimes it will create heat and sometimes it does not. And so if it does, then that's great and it can be detected by a lot. But if it doesn't, then this is the test that's going to show some of those things earlier. Now the surface proteins, it does test for some surface proteins, but not the ones that I mentioned, but not, I don't know any test that's going to test for all of them unless you go to some of the universities. And I have tested, I have sent blood to some of the universities, Duke and Harvard and some of the other ones.
Okay. Let's see. Here's one. Do you typically recommend using a biofilm buster before the test? And if so, for how long?
So, yes, yeah, you can use a biofilm buster. I technically don't want to use it too long before because they tend to, I believe in breaking biofilm very judiciously. So if you break a bunch of it really fast, then you are going to have a real case on your hands. And I don't like my patients seizing all over my floor. So I like to break it up slowly. However, I will give them biofilm busters for about a week before I test them so I can have a more accurate testing.
Okay.
Every
Great.
one of these
Good to
people
know.
actually had biofilm busters before that. So
Okay. Let's see. Ray asked, how high dose do you use for IV vitamin C?
I will. So I work them up to 100,000 if they're going to tolerate 100,000. So
Wow.
not everybody can tolerate 100,000, but I can. Most people will tolerate up to 75,000.
Okay. Let's see here. We have just a couple minutes left. Let me try to get a couple of others. Oh, we just had a couple questions. Specifically, what biofilm busters do you use?
I use a different ones, so it depends on the patient. Some of mine come with biofilm busters that they already have, that they already like.
Hmm.
I don't try to change people. I'm gonna go with what they have. So I'll use a myriad of biofilm busters. I can't say that I have any specific one that I'll use more.
Okay. I'm going to squeeze one last question in. Let's see. Dr. Hubkova also asked, when you say 14 to 30% of Lyme patients develop neuroborreliosis, how were they diagnosed?
Okay, so that those people in those specific studies that came up with those tests, they were all done by growing out the Borrelia from the spinal fluid. So that's how those tests were. That was the studies that were done with that no, in that specific test. So they grew out the Borrelia. Now I've had several people that actually have had MRIs that actually I've had several of them now that their MRI and the doctor said you have Borrelia on your brain. So that actually saw the spirochetes in the MRIs, which was kind of different.
Wow. Um, wow, that just sounds so. So, as far as testing the spinal fluid, that's obviously such a specialty test, um,
Right.
and probably not going to happen unless you have good reason to send that out, I'm sure.
Right, and that's why, well, your PhD that I had the privilege of speaking with, he said that this testing here was so sensitive that even the blood test was you were going to have a better chance of doing that than getting spinal fluid and doing a similar
Correct.
testing. So he
Yes.
said he believed that it was so sensitive, and I really believe him because he's done a lot of studying in it. So I mean, it was it was a privilege to be able to speak with them.
Yes, awesome. And it was incredibly helpful for you, Dr. Crozier, to jump on a call with us beforehand a few weeks back and kind of walk us through, what you were looking for from a Lyme test, what you thought about ours, and give us that feedback early on so that we could make it the best Lyme test out there. So we're really happy that you're happy with it, and we hope that other providers are also going to be pleased with how useful it is, how accurate it is. So far all I've heard from feedback wise from providers who have run samples early on here is wow, it's picking up Lyme or co-infections in patients that I couldn't pick it up on other tests. So that's definitely what we want to hear.
Right.
All right. Well, so we will, and do you want to throw out contact information, like as far as your consulting that you do? Do you have a website or email address if somebody wants to contact you about that before we wrap everything up? Or do you have a general website they can kind of go check out?
Well, my website for that is still in development because because I got so busy with my new books coming out. But you can contact my office and we can set that up. Usually, I'll do a little phone consult with you first to see what kind of help you want and how involved. So there's been several people that I have gone to their practice and I've spent a week at their practice going through their cases and going through. And you know what? I learned from you guys too. So I have to be honest, that I still learn things too. But I love doing that. I love spending time in the physician's practice, because a lot of times you get to see the nuances and you get to see what they can do and what they can't do.
Mm-hmm.
And we can look at the different states, because not all treatments are allowed in all states. So, like peptides. So
Mm-hmm.
peptides are not available in all states, but peptides are something that I use quite a bit of, and I see great results with, and really help me in my treatment modalities with these Lyme patients. So, so I like to, spend some time. So if you call my office, just say you're a doctor that wants to do some side consulting with me, and then we'll set up a little free conversation where we can talk.
Great. That's incredibly generous, Dr. Crozier. And as always, once again, thank you so much for your time this evening.